why is Ozempic all the rage? That was the question. And I'll say that there's a lot of, it's so interesting. People can become so polarized about something like Ozempic. And I think that Ozempic is basically semaglutide, right? So it mimics the action. So it's called a GLP-1 receptor agonist. So all those big words basically just means that it mimics the action of GLP-1. And all you need to know about GLP-1 is that it helps to increase insulin secretion. So it increases your natural insulin secretion. And when we increase our insulin secretion, what happens? We get increased blood sugar disposal, right? So we are taking the blood sugar out of the plasma, we're taking it out of the blood, and we're dumping it into the cells. So it's going to improve glycemic control. So you're going to see better blood sugar markers with it. It also makes you less hungry, right? It reduces your appetite. It makes you feel fuller longer. Side effects may include nausea, vomiting, diarrhea, abdominal pain, constipation, loss of muscle mass. It's like one of those commercials, like side effects may include death. So where I think we go wrong with medications like this is I do think that it's a useful tool for an obese patient, for a patient who is a victim of the system, really. Let's just call it what it is. Someone who is a type 2 diabetic, someone who has cardiovascular disease. These are largely lifestyle diseases, right? So this is where, we may see someone overconsume calories over a very long delta. Typically, it's processed foods, and it's not necessarily the processed foods that are causing the weight gain, but it is the lack of satiety and the over-consuming, the increased caloric ingestion of the foods, of course, that are causing the weight gain. So it's like that KICO, right? It's like calories in versus calories out, or CICO, depending on how we're pronouncing the C in CICO, KICO or CICO. So someone who's fallen to the system, that's how I would like to say, can really benefit from this. So someone who's obese or morbidly obese, who has dysregulated dopamine responses to food, who may have a history of trauma. There's other things that are sort of contributing to the obesity. Maybe they're on other medications that are also driving up obesity. I do think that this medication can be useful. Where I think we're going wrong is where we see celebrities who have all the access in the world to chefs and trainers and stress management techniques, where they are using the drug to drop weight quickly. And they pair that with their own caloric restriction, let's say, and fitness, and they do it maybe for press, for attention, or whatever. I call them, garbage rags that you sort of see in the nail salon or whatever when you're checking out at the grocery store. Every sort of raggy magazine always wants to feature someone who's dropped so much weight, the before and the after, right? So a lot of celebrities, unfortunately, kind of know that if they want to get some attention, maybe there's a movie coming out or there's something they want to promote, or they're just trying to stay relevant, are getting on this drug and, trying to take a piece of the attention pie, we'll say. And I think when you've been in the healthcare field as long as I am, you start to see patterns emerge over and over again. And once you see the pattern enough times, you can sort of recognize it when it's starting. So here's kind of what it looks like. And Ozempic fits all of these. So there's this new miracle drug cure-all, right? Then we see the pharma marketing machine sends drop dead gorgeous pharma reps to doctors' offices who flirt, who make them feel special. They're taken out for steak dinners. They're given bonuses for prescription behaviors, which can and absolutely do influence their behavior, the way that they are scripting out these drugs. The drug is given en masse to the population, right? Because we have these doctors that are being influenced consciously or unconsciously through incentives. And it's given out en masse, and then we start to see side effects. Raise your hand if that sounds like something that we saw in the last couple of years. I think that you see that pattern enough times, like miracle drug, no side effects. And then you see the reports and it's like redacted, redacted, redacted. And then of course, once it's out en masse to the population, we see the side effects. Unfortunately, we see the side effects. And then it's usually not corrected until like 10, 20, sometimes more years after the fact. So that's my thoughts on Ozempic. I think it's useful, and I think that we need to proceed with caution. And if there's one thing that I can do for you, my listeners, my dear listeners who I love so much, is that I can teach you how to think critically and maybe suss out some patterns that may not be inherently obvious to you because you haven't been in practice or whatever the reason is for however many years, but for you to think critically for yourself and for you to advocate for yourself. That would be how I would. If there's anything that I can ever do for you, that's what I would want. That's what I would want for you.